the sessions ahead. Thank you.
Namaskar. Good afternoon. So we are, I think, more on the dais than in the hall. Ladies and gentlemen, CAHOCON 2024, last day, last session of the event. We want your interest. Even Dr. Gyani and Dr. Vijay are not paying attention to me. Okay, sir. Okay. All right. So our topic today is, are we working together? What are we talking about? Should we be working together? And if we are working together and we should work together, then for what? The theme for CAHOCON is making healthcare more efficient, effective, economical, and equitable. If that is the case, we all have to work together. And I can say this conference, I see a lot of doctors, I see a lot of nurses, we have people from quality, we have people from rehab, we have people from diagnostics, we have people from administration, we have people from the IT industry. So there are a lot of people who are part and parcel of the hospital functioning. Hospital is a big place. In each vertical, we've got master experts. Will they listen to each other to work together? Let's hear from the experts who we have. So we have with us Dr. Gaurav Loria, my co-host, on my right side, who is the quality and ops head for our group of Apollo hospitals. We have Captain Madhukari on my extreme left. She is the nursing director at Apollo Eastern Region. Dr. Sunil Muntkur, he is a clinician and a quality man. Have known him for a long time. Professor in pediatrics at KMC. Dr. Anna George on my left. She is a group head with group head quality with Astro. We have Dr. Suvin Shetty, who manages diagnostics, is a consultant pathology and lab head at Hiranandani. We have Dr. Shudra Jyoti from the pharma, the expert, clinical pharma. For the rehab, we have Dr. Sadli talking about rehab. He's the AGM quality at Sakra Ward Hospital. And for clinical dietetics and nutrition, we have Ms. Sangamitra Chakravarti from Medical Synergy. I wish with all of them, we also had somebody from clinical information technology. That's a piece, impacts probably each of these functions in the hospital, difficult to make them understand. And for us clinical teams, difficult to understand their language. With that, I am setting the context for this. Healthcare has to be efficient and effective. For achieving that, all of these functions have to think alike, have to have a common goal, have to come out from their narrow verticals, at least in the thought and in action, have to come out of these silos, have to discuss the only factor. And the only factor is our patient. We heard yesterday it is no more patient-centered care, but patient-driven care. The coming era is a patient-driven care. If it has to be patient-driven care, patient does not care what is your profile or function in the hospital. For him, he wants fast response, right care, right treatment without delays, without complications. He wants to have his medication on time. The nurse can't tell him, sorry, your medication has not yet been written by the doctor in the hospital EHR, or your medication has not arrived because pharmacy delay is there, or there is a delay of medication, or delay of validation of the medication, or your reports are still awaited. He says, you sent it at 5 a.m. You woke me up from my sleep. at 5 a.m. Why my reports are not ready till 2 p.m. and you are not able to give me my sodium or the potassium correction? The nurse doesn't have the answer because in our setup, especially the bigger hospitals, everyone is very, very, very busy and we don't really talk. How many times you have the microbiologist or the infectious disease doctors coming and discussing positive cultures along with the intensivist at the patient's bedside? How many times you have the clinical pharma team walking up to and discussing the dose and the appropriateness of medication at the patient bedside? Just setting the context for this. So, ladies and gentlemen, we'll take forward this session with all of them giving their opinion through a case study. And we would want to hear from the audience at the end. Is there something better we can do to make this care holistic, comprehensive for the patient to get the maximum effectiveness when he is in a hospital for the care? Over to you, Gaurav.
Thank you, Colonel Binu, and thank you, Kaho, for having me here today. I think what all of us need to understand that patient safety is not just not a checkbox on a checklist that is printed, and we just check it up and we say that okay, our job is done. But I think it is also very imperative to understand in the huge healthcare landscape, where do all these dots connect? 5.9 million incidents happening just in India, more than 99,000 in US. And these incidents are not happening because there is a lack of skilled manpower or people don't know what they have to do, but these are mostly happening because either there's a communication gap or we have not been working together, as rightly laid down by Colonel Binu as the interesting and the opening statement. With that, I would like to open it up to all the panelists that we have here today with a smaller example on about a patient who had a total knee replacement in a hospital. This patient has suffered adverse outcomes. For example, in many ways, wherein doctor advises a daily rehab to be done post TKR, and this is not done every day and actually missed on holidays and Sundays. This patient developed DVT, had multiple critical test results which were reported but not informed and taken seriously from that perspective. Unfortunately, this patient also had a severe allergic reaction to a medication which was not rightly identified in the medical record, though it was known before. Nurses would have given the handovers on patient's condition during every shift, while there were definitely key pieces of this information which was missing during the handovers. There was again an additional category of drugs which were added by the intensivists, irrespective of the fact there was a primary treating consultant, and then there were duplication of medications which finally patient took. Now, all these things actually created many problems, severe outcomes, and obviously an increased length of stay for this patient. This is just a hypothetical patient. I hope none of us ever receive such a patient in any of our hospitals or healthcare space. But considering this particular case that could happen either in bits and pieces or it does happen in our hospitals, what do you think from your perspective? And this is the question to my panelists on their perspectives on what could have been done to ensure that this patient did not have any adverse outcomes, and what would be the roles of each of these disciplines in actually preventing these kind of incidents. So with that, I would like to start with Captain Madhukari first on her perspective on the nursing piece as to what does she think about it.
Good afternoon, the panelists and my moderators, and also the audience present here. Thanks to Kaho for giving this opportunity to me. This is a very good scenario where we can talk about adverse events created by us, by our negligence, mistakes, ignorance, and any sort of you can say that perseverance, wrong in perseverance, and doing anything that is not good to the patient. So, from the nursing perspective, I can say that yes, this should not be done. This should not have happened in any hospital, ideally. But it is important that what sort of environment we create in the organization so that our patients are safe. I mean, in terms of that if I am the caregiver, what sort of care that I am able to give to the patient in an individualized manner. So if I'm able to give that, then in that case, what sort of support that I require from other verticals? I was hearing, when I was in nursing, I was hearing from one of my Parkway clinicals MD. He was saying, see, nurses are in the center point. And like surgeons, they will not be asking for the instruments. They will put the hands and the help should be given to them. I wish we are in that dream world where we will be really able to cater that type of environment for our nurses to be so meticulously giving nursing care by which they will be able to prevent all such adverse events and they will be able to keep their patients safe. So it is important for them, of course, the checklist not to be made a tick list because we tell them to make many checklists, right? From only if we take assessment, we talk only about assessments. It is nursing assessment, daily nursing assessment they have to do. They have to do Braden score assessment. They have to do fall risk assessment. They have to do DVT assessment. And everything we expect that they will do perfectly. They should do perfectly. Then if they do perfectly, where is the chance of adverse event? But every time it may not be possible because they are into multiple things. I always say that a prescription may go wrong, but still the harm may not reach to the patient. The indenting may be wrong, the dispensing may be wrong, but once administration is wrong, that means we have reached harm to the patient. So by all means, for everything, we have to be careful, careful, and careful at every step. That's how we like to instill in our nurses so that we can prevent such occurrences in the hospital.
Thank you. Shubhro, can we have your perspective on this?
So good afternoon, everyone, and thanks to CAHO and definitely thanks to Peerless Hospital Calcutta for giving me this opportunity to be on this panel. I think we will decide as a panel whether we are working together or not, but I can give you the general perspective that are we working together or not and what together means for me. So I just have thought about it yesterday night. At least I can give you a few examples where we are working together. That case is definitely an example of where we are not working together. So T for me is trust. How many of us trust our nurses, the doctors who are sitting here? I have my very good friends who are clinicians. They will ask 10 times the nurses whether these reports are proper, are they done at the right time? So trust is a very important component of togetherness. O for me is organizational culture. Do we have an organizational culture of working togetherness or not? If a patient, the unfortunate patient who suffered this particular outcome, definitely reflects that the systems have failed. There's no organizational culture. And ladies and gentlemen, we heard our very respectable NMC person who spoke that this culture is being developed in India right now. How will we work together when our undergraduate doctors never go on a round with our trainee nurses and our trainee pharmacists? Unless we train them in the colleges where they are getting trained, this organizational culture will never come, no matter how much leadership wants. G for me is gratitude. How many of us thank our pharmacist? Those pharmacists who will go to every patient side, pick up the phone, tell that this particular insulin is looking as 100 and not 10 units. Rather, the doctor will get very irritated and say, wo to 100 कभी हो ही नहीं सकता है. It will be 10 units. So we lack gratitude. We are not giving a thank you card to any of our nurses who's really saving a patient of hyperkalemia to go into arrest. So that is gratitude for me. E is empathy towards each other more than patients. If a nurse is doing a 24 hours duty and we know why they are doing it, are we empathetic towards each other? If a DNB student has forgotten to write a particular thing in a prescription, the pharmacy will pick up the phone and call the consultant saying that your unit student has done this. Have we been empathetic? That's the big question we need to ask. We also need to ask the T in together, which is timely response to our request. When we want I think Subin is an expert here. Subin will talk about the critical alert values. When we are not talking about hospitals like Peerless or Apollo or Hiranandani. We are talking about the small hospitals because quality has to come in there. Does the nurse has the empowerment to call up the doctor and speak that this is what is lacking in this patient, this is what needs to be done? Is the doctor ready to hear? If these answers for this checklist is yes, then we definitely have the E, which is with the H, which is hearing to each other. The other E is evidence-based medicine practice as a team. Doctors are practicing amongst themselves. Nurses are doing something. Pharmacists are doing something. How many of the guidelines have been developed? And I'm sorry, I have not included dietitians. They're extremely important component of this part. How many of the guidelines in India have been developed by collaborative approach? Very few to name one of them. So we need to actually develop guidelines where nurses needs to be invited in doctors forum, where the pharmacists have to be invited into the nursing forum, where the dietitians, I'm sure they're doing their bit, have to be invited into the nursing forum. Then only we will be working together. And R, according to me, is to be receptive to ideas, something which we have forgotten for a long way. And last, I will say R for me is also multidisciplinary research. This is something I'll just quote a figure which I saw today morning. India contributes to 2% of the research on PubMed, and among that 2%, 0.002% is multidisciplinary research, means doctors, nurses, pharmacists have published together. That if we are not doing, I'm sorry to tell, we are not working together, but we have to work. I'll end saying that at Peerless Hospital, we have always believed in working together, and we have published studies where our dietitians have figured out there are problems. They've talked to the clinicians. We have taken out those problems. At Peerless Hospital, where the nursing has talked about that these are adverse events, medication errors. I thank the management of Peerless Hospital to allow us to publish our errors. We are the only hospital in Eastern India which has published medication errors. So unless we work in a multidisciplinary team, ma'am and Gaurav, I think we are not working together, but our millions of patients are getting, they're getting the best outcome. So I'm not a negative person. Definitely we are there, but dil mange more.
So with Dil Mange More, let other speakers give their perspective. Let's hear them. You made a lot of points. Yeah.
Thank you, Shubhro. Saril?
Namaste all. I can see that in the scenario, it all started with a physiotherapist. And I represent the rehabilitation landscape for India and abroad. Everything boils down, according to me, to some core values. And I would say the first and foremost is respect. As a team, if you all start respecting each other, and most importantly, respect the patient and the caregivers. And also understand that my colleague probably might be very busy for today and they are engaged in something. So that kind of a respect that everybody's job is equally important, if not sometimes more important than each other. And then integrity and taking ownership. Sometimes things go wrong. We're all human beings. It's fine. But having that integrity to really, say that openly and take the complete ownership of that situation, everybody together, that's where the teamwork comes in. And also backup for each other. I think that's a great quality. Maybe if there is a clinical care pathway which said that the physiotherapy was missed out, maybe if the nurse has noticed it, could just give a call and find out that, hey, today this is so-and-so thing is missed out on a Sunday. Are you available? Or find out with something, and we avoid delays. And that's again because of the respect for the patient and prioritizing patient on top of everything else. And in the end, I think if we have to do all these things, we need to be extremely passionate as a quality professional, irrespective of what is our technical, the genre that we belong into. We might be a doctor, nurse, dietitian, physiotherapist, but I think quality binds it all. If we prioritize quality above everything and put the patient in the center, it's a huge team with a patient in the center who is driving all the activities. Then we understand that I'm part of the team and my patient is also part of the team.
Thank you. Ms. Sangamitra, can we have your thoughts on it?
A very good afternoon. Thank you for inviting me, Caho. I think this is the first time a clinical dietitian has been informed. You see, we are extremely neglected in the field of critical care or in hospitals because most people do not think nutrition to be a therapy. It is mainly to please your taste buds that you eat. People do not understand the importance of nutrition as a therapy, and maybe that is one of the reasons why it is so overlooked. I personally feel that we are all doing our jobs very well, whether it's a physiotherapist or the dietitian, the doctor. We are all doing excellent jobs. We have wonderful score sheets. We are documenting our care, but we do not speak to each other. It is only when the patient is doing badly in front of the, say, in the mortality meeting or when there is a board meeting and the patient relatives, they come and charge us that you have not looked after our patient properly. It is then we get together and we start talking. But this should be done much earlier. So what I typically face as a dietitian, I think my colleagues also face the same. The doctors should discuss with us what exactly their plan of therapy is. We come across new problems every day. New bugs are coming up every day. Every day in the ICU, I come across new names. So complications are rising, new drugs are there. So unless we know what kind of therapy the doctor is planning, whether it's going to be aggressive, whether he's going to take a more gradual approach, a palliative care or not. So that will largely determine the way I would plan the diet for the patient. Similarly, it is very nice to plan, fanciful diet charts. I can have a very fanciful diet plan worked out, but if the nurses are not able to deliver the feed, or if there is any problem, the patient is not able to absorb the feed and we do not get the feedback, then there's no point in having a very fanciful diet chart. Similarly, we need to interact with the physiotherapist as well, because no matter how much of protein and nutrition we are giving to a patient, if the patient is not mobile, the muscles will simply not be built up. So we need to know whether the muscle tone is improving in a patient or not. That will depend on our interaction with the physiotherapist. As now the pharmacologist, the pharmacist will decide on the kind of drugs that the patient is having. We have something called nutrient-drug interactions. So it really depends on whether the food is interacting with the drug or not. That will lower the efficacy of the drug. So unless we actually sit and discuss a patient, at least for the long-staying patients or the ones who are having complications, I think it's very important for all the team members to sit together and discuss what we are doing, at which level we are. In that way, we will understand the other's perspective. There'll be no blame game. So we can actually have a more holistic approach. So I think it should be done for all patients. The patient that you mentioned, we do not know whether the patient was properly fed or not. So we are dealing with the GI tract, dietitians. GI tract happens to be the largest immune organ of the body. We talk of infection control, but what about the GI tract? Are we taking care of that? There can be bacterial translocation if the patient is not fed properly. Hygiene precautions need to be taken by the dietitian as well. So I feel a more holistic approach is needed.
Sure. Thank you. I think interesting points. Suvin, your ideas.
Good afternoon, everyone. The question was, are we working together? I believe and I do trust in the fact that we do work together. There are challenges. There are times when lacunae would get exposed. But overall, I feel it's up to the department heads or the senior team members in the hospital to make a smooth transition between various cadres in the hospital, whether it's doctors, nurses, technicians, therapists, all included. If I talk from the case which Gaurav discussed in the beginning, I mean, that case itself will have a lot of lacunae that can get exposed if it's a kind of in a realistic manner. I mean, if I'm talking, and I'm talking from the laboratory perspective, a wrong test may have been asked, a wrong sample may have reached, a test has been, possibly we consider the analysis would be right, but the report has been delayed for whatever reason, and a wrong communication has been given. So all this perspective would have possibly led to patient safety. But when I look into my own team members, at times in a laboratory, a thought process can set in. A culture can set in that we are just looking at a sample, and results are basically, the test results are having erroneous values. The patient safety is not what is in the grain. So it's finally the culture that we inculcate in our own team members. I truly believe the onus is on the senior members to build in a culture where the teams can work together. Thank you.
Thank you. Dr. Sunil, can we hear your thoughts on this?
Thank you, Gaurav. Are we working together? When I got this topic, I was wondering which word to answer, or where first. We means who? Is it the doctors, nurses, or the hospital employees, or it's doctors, TPAs and the insurance companies, or doctors, Medical Council of India, or accreditation bodies? I was wondering what is this we mean? Then when I saw the panelists, then okay, it should be hospital related. At one point of time, I came to know that we means the organizing committee of CAHOCON. Then it was proven that they have worked fantastically well. Thanks, Kaho, for
They
giving
have
this
worked together.
opportunity. Going to your scenario, that Swiss problem that has happened, it's a very, very rare scenario and nobody should suffer from it. But if you see, from the clinician perspective, there's a serious communication failure. As a clinician, I would see there are three processes which are important as per the clinician's perspective is concerned. One is medical care, because patient has to survive. Two, documentation, because the patient and the hospital has to survive. Communication, because patient, doctor, and the doctor has to survive. Although we say patient-centric care in the hospital, after the patients, it is the doctor that is important. Hospital minus doctor, can the hospital work? Although all these are support services to the patient care from the clinical side, without the clinician, the hospital cannot work. So the documentation, the communication, the documentation, and the clinical care are the three most important facets of clinical care delivery. And how often a clinician is trained or clinician is efficient enough to deliver this care. Even if you ask me today, after 25 years of experience in pediatrics, can you treat successfully 10 upper respiratory tract infection in children? I don't have the confidence to say yes, 100%. That is the clinical scenario, because 1 + 1 is not always 2. Every patient who comes to me, I look at them as a potential litigant patient. The drugs which I treat is determined by somebody else. The care that is delivered by somebody else. And let's say in this scenario, the patient files a case against the negligence. Who is answerable? It's the doctor. Ultimately, everything boils down to the doctor. Is he trained to handle negligence in his clinical curriculum? Is he trained to handle quality in his clinical curriculum? No, we don't have that training, and we have to develop that training. Then only we all can work together. But this question, if you ask me, are we working together? My answer is yes. I'll give two simple examples. 4% of the hospital patients develop hospital-acquired pneumonia in India. That means to say 96% do not develop. 44 prescriptions which reach patients out of 1,000 prescriptions, do have medical errors. That means to say 964 is not having it. That means to say we are working, but we can work better. That's the message.
Thank you. Anna, can we hear your thoughts, please?
Very good afternoon to all, the panelists and the moderators. So as usual, quality is last. Did you guys observe that? So what does that say? Are we working together? Now, most times what happens is, just like how you saw here, quality comes last, to do a root cause analysis when the incident is finally raised. And that's exactly what we are doing now as well. And that time we all come together and discuss on what went wrong. And it's very easy to close that incident because we just have to pin it on the staff or the final person who was there working frontline. Because then we just have to close it with training and that's it. There's no process change. There is no other deliberation done. And that's what we normally see based on the past experiences. Now, we all talk about policies and SOPs, something that is very, very integral, especially when you're going in for an accreditation. Again, what we have seen is most places have SOPs and policies written down because they need to apply for the accreditation. Now, we need to think about how many people are actually involved in documenting these policies and protocols. Are the same people who have to carry out these policies and protocols involved in this process? When there is involvement, as the topic goes, are we working together? When there is collaboration in defining these policies and protocols, we know that there is a buy-in from all stakeholders, which means they are involved and they will follow it. Secondly, the culture of safety. The term that is like now a buzzword, and we do surveys and all those things. Why are we actually doing it? What is culture of safety? It means doing it right when no one is looking. And that is top driven. So whenever there is an incident raised or when there is something that happens, are we empowered to raise it? One. Second, are we empowered cause analysis? And three, are we ready to hear another person's perspective? A clinician's perspective is different. A nurse's perspective is different. A quality manager or a physiotherapist, a clinical pharmacist, perspectives are different. And that's what's most wonderful about this industry. But are we open to hearing their perspectives and thinking, oh, that could be right too. We need to incorporate. So looking at things in general, are we working together? We are trying to, but I think we have a long way to reach. And probably these kind of forums, CAHO, or the kind of forums that we participate in, help us to think. There's a lot of thinking going on today now in the room as we speak, but it's all about when you go back, how do you progress into implementing and changing that culture within your organizations?
Thank you, Anna. With that, let me just put across a brief summary. 10% of patient feedback, I'm talking of negative patient feedback, comes about interdepartmental coordination, which means there is definitely a gap what our patients see when they visit the hospitals, either as outpatients or as inpatient. What I see, it boils down to changing the organization's culture, which has to be top driven. I can just quote my 20 years back experience. I had a boss by the name of Dr. Vijay Agarwal at Max Healthcare, and he's in the room right now. So at that time, we were designing processes for the hospital. We involved doctors from various departments, nurses, rehab, front office, pharmacy. That was the first ever time I had an exposure. This is how processes have to be designed. So if you are involved in designing those processes, even doctors would think twice before rejecting that. That's point number one. So a culture in the organization must change, which has to be top driven. Number two, I think definitely more collaborative approach. I would say that should start at the time of onboarding. You have people joining new hospitals. How many times do we have across departments a common onboarding program or an induction program, including doctors? We all think doctors are expert. They don't need to have a onboarding. In some best places, they are given a PowerPoint on the desktop. Doc, when you have time, have a look at it. They do not know about the processes in the hospital. They may be best CTVS surgeon or a GI surgeon. He doesn't know how your hospital functions. And empowerment for every single person in the hospital who can raise a voice, who can be a whistleblower when something has to be raised. And a lot of points, gratitude. During COVID, during dengue outbreak, hospitals were loaded with work. There were some departments which didn't have enough work. For example, maybe finance, billing, IT. There were some departments which are loaded with volumes, nurses, doctors, customer care. How many times we took effort to get all those back-end departments out to support nurses, doctors, front office? It is one common place. We are all together in a hospital. If one department is busy, to the extent possible, all others should stand together. Only then we can work together. Empathy and having common meetings to actually discuss issues, problems, and processes. I think with that, I would say a more collaborative approach. Yes, we are all trying to work together, but we are not yet where we should be to get the best result out of it. And a parting statement from each speaker, not more than 30 seconds. We have already done with our time. If there is a parting statement, briefly, you may please speak up. Yeah. Very brief because we have to start the next session.
As in my initial remarks itself, I said, okay, yeah, majorly we do work together. There are challenges. There are areas that we require to work on, culture, leadership, and other aspects that we have already touched upon, agree upon that.
Well, I am a big Bollywood fan, so I will say, अकेले हैं तो क्या गम है mode से we have to move to हम साथ साथ हैं.
I think the very fact that we all are sitting together, this must be the historic moment where so many different disciplines are respecting each other and sharing the stage. Probably this is the starting of a new era where we start working together more efficiently and effectively.
Well, I think we should start early. Once the patient is admitted, I think we should have at least one meeting. All the disciplines, people from all disciplines should get together and we should discuss about our patients and where exactly we stand, not wait till the end when we have to attend the mortality meet or when the patient charges us.
So let's all swallow our pride, egos, and keep that aside and collaborate to our end goal, the common goal, that's patient safety and a happy patient.
Yeah, from a clinician perspective, include quality in the clinical UG, undergraduate and PG curriculum to allow doctors to do only clinical work, communication and documentation, take all non-value added processes, and 3, involve more clinicians into quality team.
I echo the same with Dr. Sunil that take out all non-value added processes from the caregivers and ensure that our patients are given our health care providers are given more time to take care of the patients so that they are able to spend more time with the patients for their need and they are making the patients more safer in terms of keeping each other's perspective, ego behind and perspective first, that patient comes first. So we understand each other and work as a team.
So I think two of the most organized processes in any healthcare system are, I guess, timeout process. If you see how a timeout exactly happens before a surgery wherein everybody works together. And the second one is definitely a code blue resuscitation process where you see everybody really working towards a common goal. So I think with that, I would like to end this session. Would like to thank my co-moderator as well as all the panelists for their views. Thank you to the audience for your attentive listening. And I think all of us really work together. So thank you. I don't think we have time for questions. So probably, we can connect at any point of time. Thank you.
Thank you, Gaurav sir. Thank you, everyone, chairpersons and faculty. I request you all to pose for a group photo. A big round of applause for the last session for CAHOCON 2024. Thank you. We'll now have the valedictory function arranged. The host for the valedictory function would be Dr. Geeta Fulari and Dr. J. Jayalakshmi. So we'll be starting the valedictory in another 5 minutes' time. Good afternoon, everyone. As we come to the close of CAHOCON 2024, the much awaited and looked after valedictory session with the award winners waiting to receive the awards.
Good afternoon, everyone. As we stand before you with a heart full of gratitude and a sense of accomplishment, CAHOCON 2024 has indeed been a remarkable journey. It's been a convergence of minds, ideas, and shared experiences. As we approach the closing moments, we would like to extend a heartfelt gratitude to all of our wonderful speakers and the panelists. May I now request Mr. Rupak Barua, sir, Advisor, Manipal Hospitals Enterprise Limited, to kindly come on stage and welcome our chief guest, Mr. N.S. Nigam, IAS, Principal Secretary, Health and Family Welfare, Government of West Bengal.
A big round of applause, please. Yes.
Please, in is.
NS.
In is.
I changed. Yeah.
May I request Rupak sir to kindly come and give the welcome address, please.
Good afternoon, esteemed guests, delegates, friends, ladies and gentlemen. As we gather here on the momentum occasion, first I would like to take this opportunity to welcome Mr. Narayan Sharup Nigam, IAS, Principal Secretary, Health and Family Welfare, Government of West Bengal. Thank you so much, sir, for your consent. Particularly, this is a very odd day, Sunday, and odd time. And you have agreed, you have given your consent to be with us. Thank you so much, Mr. Nigam. I'm filled with a profound sense of gratitude and pride as being the cutting down on CAHOCON 2024, the 8th International Conference of CAHO, which took place at Kolkata Vishwa Bangla Convention Center for the first time. Over the last 3 days, we were witnessed, including the LabCon, to an extraordinary journey with enlightening sessions, insightful discussions, and invaluable connections. Today, as we bid farewell to this remarkable conference, I must reflect on the many sessions that have unfolded before us. This remains no doubt that the inaugural keynote address by our Chief Guest, Honorable Dr. C.V. Ananda Bose, the Honorable Governor of the West Bengal, who has set the tone for our deliberations. The thought-provoking panel discussions and interactive workshops that followed each sessions have been a testament to the collective wisdom, expertise of our esteemed speakers and delegates. As you all know, CAHOCON 2024 is endorsed by pioneering institutions such as NABH, QCI, ISQA, and ASQA, which also stands as a testament to our collective commitment to fostering quality in healthcare, enhancing healthier life for all of us, transcending geographical boundaries and socio-economic barriers. We have explored a wide range of topics, delving deep into the frontiers of healthcare, innovations, collaborations, and excellence. From the transformative potential of telemedicine and artificial intelligence to the imperative of patient-centric care and healthcare sustainability, our discussions have been as diverse as they have been illuminating. One of the key learnings from CAHOCON 2024 has been the importance of embracing innovation and collaboration in driving positive change in healthcare. We have witnessed firsthand the power of technology to revolutionize healthcare delivery, improving access to care, and enhancing patient outcomes. At the same time, we have been reminded of the fundamental importance of putting patients at the center of effort, ensuring that their voices are heard and their needs are met with compassion and dignity. Moreover, our discussions on healthcare sustainability have underscored the urgent need for collective action to address pressing global health challenges, such as access to affordable healthcare, healthcare disparities, and environmental sustainability. It is clear that only through collaborations, efforts, and a commitment to equity and inclusivity can we hope to build a healthier, more resilient world for all. As we bid farewell to the CAHOCON 2024, I would be remiss if I do not take this opportunity to express my deepest gratitude to our distinguished guests, whose presence and insights have enriched our discussions and inspired us to aim higher. To our dedicated delegates, whose passions, enthusiasm, and unwavering commitment to excellence have been the driving force behind the success of this conference, I extend my heartfelt appreciation. Last but certainly not the least, I must extend my sincere thanks to our sponsors whose generous support and unwavering behalf of the mission have made CAHOCON 2024 possible. Your partnership has been invaluable, and we are immensely grateful to our continued support. Also, I would like to take this opportunity, the government of West Bengal, led by Mr. Narayan Swarup Nigam, Principal Secretary, Health and Government of West Bengal, for giving us so much of support in terms of all kind of knowledge, all kind of this, the venue, everything has been supported by the West Bengal government, and government of West Bengal, the health division is our actually healthcare partner in this endeavor of CAHOCON 2024. Hope you have enjoyed these last 3 days of conference, warmth of Kolkata, the hospitality of Kolkata, the city of joy, and I wish that once again, we would like to get the opportunity to convene this CAHOCON again in some 2000, some year in Kolkata. And till then, let's goodbye. Thanks. Namaskar. Thank you.
Thank you very much, sir, for that wonderful welcome. And we really felt the warmth of the city of joy. And thanks to the host and the hospitality as well. So we would request the dignitaries and the dais to just come in the front of the stage to for some recognition of eminent personnel who worked hard to achieve and be where they are, to inspire more people for the future. So we are going to give some recognition awards, and I request our CAHO president, Dr. Vijay Agarwal, to hand over these prizes. Yep. Bring it. Yes. I'll bring it.
Can get the citations. Whichever, in what order are you giving?
Citation, it is yours.
Geeta, you bring the citation. I'm reading it. Just read it. So thanks to Vijay sir for a small change that we would want our chief guest to honor the recognition of the award winners. So Vijay sir would read the citation as the chief guest would hand over the mementos and the award to the winners. The first would be a Lifetime Achievement Award, national level, and this is to Dr. M.I. Sahadullah. Big round of applause. I think you should be a little bit more generous in clapping.
So, Dr. Sahadullah, please come on the stage. Whom are we giving? So, Dr. M.I. Sahadullah, Dr. Muhammad Elias Sahadullah, Chairman and Managing Director of KIMS Health, brings over 45 years of global health experience to his leadership role. With fellowships from the Royal College of Physicians in Ireland and London, and MBA from Hull, UK, he has shaped KIMS Health into a leading healthcare provider with a significant presence in India and the GCC. Dr. Sahadullah's tenure at Saudi Aramco emphasized healthcare quality and safety, influencing his successful implementation of international standards at KIMS Health, earning it as the ACHSI Gold Medallion 2015. Under his vision, KIMS Health became a pioneer in accessible quality healthcare across Kerala and expanded internationally. Dr. Sahadullah is recognized for his academic contributions, including as an MRCP examiner and his published works in medicine. His leadership extends to influential roles within several healthcare organizations, making him as a prominent figure in healthcare management and quality improvement.
This might even require a standing ovation, please, for Dr. M.I. Sahadullah. Thank you very much. So we move to the next award. This is a Quality Champion Award, and this is awarded to, so I would want to say this.
So the Quality Champion Award 2024 is going to Dr. Shweta Prabhakar. Dr. Shweta, please come over on the stage as I read your citation. Dr. Shweta Prabhakar receives the Quality Champion Award 2024 for her 23 years of healthcare excellence spanning clinical practice, quality, patient safety, and leadership in both academic and hospital settings. Her achievements include leading quality initiatives, achieving accreditations, and serving as NABH Principal Assessor. An esteemed academic, she has contributed significantly to healthcare education and process improvement. With an MBBS and a master's in hospital administration, plus certifications in healthcare quality and management, Dr. Prabhakar's work has earned international accolades such as the ACHS International Medal for Leadership in Quality and the Level 3 Qualitist designation, affirming her role as a key healthcare leader. Yeah, we had told you to be careful. Then you can speak. I think there's communication with that. Sorry. With you, but last May.
Sir, thank you.
Vijay sir, the next citation, Young Quality Achiever Award.
One more.
And the winner for the Young Quality Achiever Award is
So the Young Quality Achiever Award 2024 goes to Abdul Dhayan Razak. In recognition of his outstanding contributions to healthcare quality and patient safety, Abdul Dhayan is honored with the Young Quality Achiever Award. A dynamic and passionate quality professional, Abdul has consistently demonstrated unparalleled dedication to excellence in every facet of his work. His leadership and expertise extends far beyond individual projects. He has tirelessly worked to foster an environment of quality excellence within numerous hospitals across India. This award recognizes Abdul Dhayan's exceptional leadership, his profound impact on patient safety, and his relentless pursuit of excellence in healthcare quality across India. This citation captures the essence of Abdul Dhayan's achievements and his impact on healthcare quality and patient safety, while also reflecting the significance of the award he is receiving. Thank you, Abdul.
We're moving on to another special award, a Lifetime Achievement Award International. And the award winner is?
This is a new award that we have started this year. This is the Lifetime Achievement Award International 2024, goes to Professor Dato Dr. Ravindran Jagasothi. Professor Jagasothi is honored for his remarkable impact on healthcare quality and safety, highlighting his 5 years commitment to obstetrics and gynecology in Malaysia, where his work has notably enhanced patient safety. Recognized for his transformational leadership, innovation, and ability to nurture team towards excellence, his mentorship has profoundly influenced the next generation of healthcare professionals, fostering a legacy of inspired leadership in quality and patient safety globally. His visionary efforts in founding the collaboration between ESCOA and CAHO have established new international healthcare standards with his leadership in CAHO's International Advisory Committee, promoting a culture of excellence. His illustrious career embodies his dedication to healthcare improvement, inspiring professionals worldwide. Thank you, Professor Jagasoth.
Group photo.
May I now request all the award winners to take a group photograph with the chief guest and the core organizing committee of CAHOCON 2024.
They'll have to hold. They'll have to hold.
I think we need to applaud loudest because we have 4 great achievers who inspire a lot of people more to achieve more. They have been examples of hard work that bring in success, which is very sweet. This is one great photograph. And how did Abdul miss this? Big round of applause for all the award winners. A very special moment, something that's looked forward every year at CAHOCON, the 2024, the award winners for the highest awardees. Thank you very much. May I request the award winners to please take your seats, and also the guests and the dignitaries on the dais to please take your seat. And it's time for us to listen to our chief guest for the day, Mr. N.S. Nigam, IAS officer, Principal Secretary, Health and Family Welfare, Government of West Bengal. It would be our pleasure to listen to you, sir.
It's a very difficult job assigned to me to talk at the end of a 3-day long session in which you people have already been given a lot of input about the latest advances in the systems, as well as what are the new things that are happening around. And maybe most of you either have packed or in the process of making yourself going to the airport or whichever medium you have come to the city. First, let me congratulate Consortium of Accredited Healthcare Organization for organizing a national workshop in the city of Calcutta, which is also a city of joy, for bringing it into the healthcare map of your thinking, as well as the importance assigned to the city. Distinguished guest, Dr. Agarwal, Madam Joseph, my friends Prashant Sharma, Mr. Rupak Barua, and all other distinguished dignitaries on the dais, off the dais. First of all, let me welcome and extend our sincere thanks and best wishes on the behalf of Government of West Bengal for coming over the city and spending 3 days. I hope all of you must have had a wonderful stay around. Now, if you look at the topic which you people have assigned is something today which the government is very seriously talking about. What is that? It is bringing what you said, that making healthcare efficient, effective, economical, and equitable. Now you look at the spectrum, all the 4E, I would like you, when you go back and think about it, what does each E means here? Efficient means that the person's health care is available to him efficiently at the time of his need. It is effective, means that it should be giving a desired outcome to the patient. It is economical. One of the serious issue which keeps on coming on us, that the private healthcare is not economical. If you are not protected by certain systems, healthcare remains inaccessible. So it should be economical and equitable. It should not depend how deep is your pocket to avail the best healthcare in the system.
So these are the very four highly important topic on which this conference has been organized. I hope all of you must have dwelled in details in a deeper, you must have taken a deep dive to come to a solution, come to a thinking that what does this all 4E means. Problem in healthcare, India is a developing country. Today we have a huge problem as far as the public health issues are concerned. If you look at it, look at the size of this country. Today we are almost the most populous country in the world, with 140 crore people surpassing China. To be provided a best healthcare poses an enormous challenge. Challenge is not only to us, but it's challenge to each one of us. Unless or until we improve our healthcare systems, can create even situations of social unrest. COVID has taught us a lot. In 2020, when we started dealing with COVID, we knew how good or bad our health systems have been, how much accessibility to healthcare efficiently we were in a position to provide. That becomes quite a big challenge for us. What is the infrastructure and resources that you will be needing in future to deal with it? Number of doctors, if you look at it, in our state, I tell you where we deal, we in last 10, 12 years, even after adding more than 25 to 30 medical colleges, still the number of doctors that we produce every year is only 6,000. We need to have more than 10,000 MBBS degrees coming every year. Look at the number. So the kind of resources that are going to be there. Earlier, whatever used to happen, the information technology was not there, roads were not there, villages were inaccessible. People were never had a taste of a good healthcare. Now everyone is coming to the city, everyone is coming to the urban center, everyone has access to WhatsApp, everyone has access to Google. They know what the good healthcare means. Now, if you look at that scenario, the gap and the resources that you need for putting it together to provide an efficient healthcare becomes another big challenge for us. At least for my state, which I deal with, we have almost 4 to 5 times we have increased our budget in the healthcare expenditure in the last 10 years. But it's still, we feel that much needs to be done. It's still the healthcare accessibility still remains an issue with us. And then the question comes, quality comes with a cost. Now you look at the depth and the income distribution in this country. CT scan in a good hospital may cost 5,000 to 6,000 rupees. In an average scenario, it may be 600 rupees also. And when I do my bidding in my setups, it comes to around 700. So such is a spectrum, and everyone says that it's a quality. Now, with this spectrum in which we are operating, what will be effective cost? Where will it come? Can the market forces play their best possible role? Is always been questioned all across, and it sells well. Let me tell you, healthcare is one such issue on the basis of which even the elections are being fought. Look at Obamacare in USA. After so many years, they have to come up with a scheme called Obamacare, which is something like what we run, a Swasthya scheme, something like that. They have to come up with that because it is something which is very close to everyone, that the people should be protected from the, should be provided services so that they can realize their human capabilities in the best possible manner. Then the challenges remain. At one side, we say we have to provide the best quality machines, best quality systems. At the same time, we say that it has to be cost effective also, so that people are in a position to get an access to it. Now when they say that how good is your insurance coverage? Now we have in our state, we have a Swasthya scheme in which almost 8.5 crore people are covered under one scheme, and I spend a whopping 2,600 crores per year just to provide access to healthcare, so that if your bone is broken or you need a cancer treatment, you are not lost. But are we in a position to create the similar system across the country? Do we have a sufficient number of, say, a medical oncologist or the orthopedic surgeons, and those number machines, LINAC machines and all those things? Is is are these projects are bankable, that the people are ready to get the ready-made financing to create these systems? And even whether the equipment suppliers are in a position to supply you these equipments. This also poses a big challenge to us. Then something which is very dear to us and which is very rightly taken up today's part of a conference is the quality of care. Whether you have a trained manpowers or not, whether you have a standards or not, whether there is a regulator to take care, establish those standards or not. These becomes a very big challenge for us. You know, when you people have made a good beginning, but the times are going to be challenging for us, and it is very important to have regular sitting among yourself, with the government, with all other stakeholders to come up with a solution. This is a path. There cannot be any absolute solutions to any of these problems. But at the end of the day, we have to provide what you have a theme, that efficient, effective, economic, and equitable. I'm telling you, it is something, nothing but political rhetoric also. That it is something which is very close to each sensible persons, each politicians, each financer and everyone, that you have to create a health system which is resilient, which is equitable, which is approachable. With this, is it possible? We have to really think out of box. I tell you one very simple example, which I narrate in many places. You know, we have almost 1 lakh plus brain stroke cases in West Bengal every year. Now, with all the knowledge about neuromedicines and the kind of degree and the kind of DM-ship seats that you have all across, I cannot create a neuro center in remote districts of Kuch Bihar or a Purulia. Even if I create a post, I won't be able to send a doctor because he will not have a sufficient traction. How to deal with this situation? So we had a very competent neuromedicine doctor, very dedicated. He said, sir, I just posed him a question. What do you do? What do you do in the process? He said, sir, fine, the CT scans have to be taken immediately in 4 hours. And if you can perform the thrombolysis, maximum number of cases, that will resolve the issue and the patient can walk back home, or he will need a minimum care and there will not be any kind of paralysis or anything. So for me, a layman, it sounds that it poses. Then we said, well, CT scan machine I can put everywhere, maybe in an accessible zone, but I can't put a doctor. So we said, fine, with the information technology coming up, we created an hub and spoke model. You won't believe, every day minimum 20 to 30 people are treated across Bengal only with this, and we could save 22,000 plus number of people in 1 year. We could just save them. So we have to, you may have an idea, we are not in a position to create an ideal situation everywhere. We have to come up with a solution in which we are able to provide a basic healthcare. The people who cannot have an access can get the services and they can get this access. This is what I was telling other day. I was sitting with my medical college professors. I said, fine, whenever you add one more logy, suppose you have a nephrology, you have a neurology, you have a cardiology. Prior to that, when these logies were not there, who were treating? Why we are creating such a halo around everything rather than demystifying the medical health care? Maybe the time has come when you have a tremendous demand and there is a less number of resources with us. Maybe some of the places we request that there should be some demystifying. Propositions have to be created so that, with the use of the technology, we are able to provide at least basic healthcare and the important life-saving healthcare to all. These are some of the things why I know that we don't have most of the things we don't have a solution, but we have a bigger problem in our hand. And we must have a right vector in the right direction to evolve a situation in which accessibility to the healthcare and in a more equitable manner can be provided. I once again congratulate the entire organizing team for choosing the city of Calcutta for this conference. as well as successfully concluding this program and giving me an opportunity to speak with all of you. Thank you and all the best. Thank you.
Thank you very much, sir. May I request Dr. Barua, sir, to hand over a memento of a token of our appreciation from the CAHO 2024 Organizing Committee. Thank you very much. We move on. Now I invite Dr. Shankar Sen Gupta, the Secretary of the Organizing Committee of CAHOCON 2024, to give the summary of the conference.
There is no slide, no? No slide. Good afternoon, everybody. Respected Principal Secretary Health, Mr. Narayan Sharup Nigam, Department of Health and Family Welfare, Government of West Bengal, to be over here as chief guest of this August occasion of Valedictory program of CAHOCON 2024. President of CAHO, Dr. Vijay Agarwal, our organizing chairperson, Mr. Rupak Borua, our organizing co-chairperson, Mr. Falin, Dr. Falin, and Mr. Prashant Sharma, the Secretary General of CAHO, Dr. Lalu Joseph. I have been told specially to be very brief in the conference summary, so I will not take much more than maybe 1 minute time. Just want to tell you the prologue that in the year 2023, last conference Hyderabad, when you took up this responsibility, we thought it will be a Herculean task. Mr. Rupak Borua was made the organizing chairman. I was made the organizing secretary of the conference. And since then, believe me, next month itself, we started working about our preparation and the implementation of CAHOCON 2024 in a successful manner. We even didn't skip the month of Durga Puja because we thought that whatever the kind of work we are doing in both LabCon and the CAHOCON organizing committee with all the members and leaders of the hospitals and the laboratories of the city, maybe it will be lose out if we don't make a meeting just after Durga Puja. And we called our national leadership, Vijay sir and Lalu madam over here, to conduct the meeting so that people cannot just sleep. Until even the last month, we are not sure this will be such a successful one. But suddenly, entire situation changed with only one thing. Mr. Rupak Borua had told, Principal Secretary has told, the government of West Bengal has endorsed this program. And then onwards, everything changed. I must say, after that, we have not looked back. Technically speaking, we have done highest number of workshops. First time in the CAHOCON workshop, more than 15 CAHOCON workshop, and LabCon is around 13. We have done altogether, we have got in all this pre-conference workshop, 1,250, more than 1,250 attendees. In the main conference, we have again broken all the record, 1,450 attendees, more than 1,450 attendees. Sponsors and exhibitors were more than 50. Partners were more than 40. Faculties across the world were more than 85. All these people have deposed faith in West Bengal. The West Bengal is also a health destination. And we really believe we have got us traditionally an unique position to be the gateway for entire Northeast as well as some of the Southeast Pacific country. So you have to develop a lot. This 3 days program has given enough opportunity to all of you to develop yourself. Thank you again. Thank you all. Thank you all the participants, all the delegates, and all the people who have helped CAHOCON 2024 a success.
We now move on to the hospital awards. The first category would be the Environmental Sustainability Awards. The first prize goes to Apollo Multispeciality Hospitals Limited, Kolkata, West Bengal. May I request the representatives to kindly come forward? Apollo Multispeciality Hospitals Limited, Kolkata.
This is the national, correct? This is the national. And others,
East and South. East, South, North. I'll just tell that. The next one goes to Christian Medical College, Vellore, Ranipet, Tamil Nadu, in the South Zone category. May I request the delegates to kindly come forward? In the North Zone, we have Shri Mata Vaishno Devi Narayana Super Speciality Hospital from Katra, Jammu and Kashmir. May I request the delegates to kindly come forward? Shri Mata Vaishno Devi Narayana Super Speciality Hospital. Next, we have Care Hospitals, High Tech City, Hyderabad, South Zone. In the East Zone, we have Fortis Hospital Limited, Kolkata. Next, in the West Zone, we have S.L. Raheja Hospital, Mumbai, Maharashtra. S.L. Raheja Hospital. We next move on to the Life and Fire Safety category winners. May we have representatives from Christian Medical College, Vellore, South Zone.
This is the sequence. Don't change it. So you finish. You finish platform, lightning, and move. I'll do the video, clinical audit, research, and posting.
Okay.
You come back for calling out the power.
So I'll finish off the platform and lightning. Okay. Next, we have Indraprastha Apollo Hospitals, New Delhi, North Zone. From South Zone, may we have Sri Kamachi Medical Center, Tanjavur, Tamil Nadu. From the South Zone, it's Narayana Institute of Cardiac Sciences, Bengaluru, Karnataka. May we request the representatives to kindly come forward. From the East Zone, may we call upon B.M. Birla Heart Research Center, Kolkata. From B.M. Birla. Next is Zydus Hospitals and Healthcare Search Private Limited, Ahmedabad, Gujarat. May we have the representatives from Zydus Hospitals to kindly come on stage, please. ठीक है मुझे In the West Zone, may we have Sayadri Hospital Private Limited, Pune, Maharashtra. May we request the delegates to kindly come on stage, please. We now move on to the platform presentation winners. In the clinical category, the first prize goes to Hamad Medical Corporation. May we request Dr. Gopinath to kindly come forward. The second prize in the platform presentation clinical category goes to Apollo Hospital. May I request Dr. Yamuna Devi Ramanathan to kindly come on stage, please. Next, we have the platform presentations in the nursing category. And the first prize goes to Ruby General Hospitals Private Limited. May I request Mrs. Viji Jason to kindly come on stage, please. The second prize in the platform presentation nursing category goes to Zydus Hospitals, Ahmedabad, Gujarat. May we request Ms. Janita John Vagela to kindly come on the stage, please. Platform presentations in the general and support category. First prize goes to Sakra World Hospital, Bangalore. May we request Dr. Saril VS to kindly come on stage, please. First prize in platform presentation, general and support category, Sakra World Hospital. The second prize goes to Jaslok Hospital, Mumbai. May we request Mrs. Hiral Sarin to kindly come on stage, please. Second prize in general and support category, Jaslok Hospital. We next move on to the platform presentation diagnostics category. The first prize goes to Meenakshi Mission Hospital and Research Center. May I request Dr. Malati Murugesan to kindly come on stage, please. The second prize goes to Ms. Dr. Rela Institute and Medical Center. May I request Dr. Akila Rajkumar to kindly come on stage, please. Second prize in platform presentation diagnostics category, Dr. Rela Institute and Medical Center. The next category we have is the platform presentations student category. And the first prize goes to All India Institute of Medical Sciences. May I request Dr. Prashant Nag to kindly come on stage, please. Dr. Prashant Nag from All India Institute of Medical Sciences. The second prize goes to University Malaya Medical Center. May I request Ms. Karthikeyani Krishnasamy to kindly come on stage, please. We now move on to the Lightning Talks competition winners. In the nursing category, the first prize goes to Fortis Mulund. Fortis Hospital, Mulund. The second prize in the Lightning Talks nursing category goes to Dr. Rela Institute. First prize, Fortis Hospital, Mulund. Second prize in Lightning Talks nursing category, Dr. Rela Institute. The third prize in the nursing category, Lightning Talks, goes to Max Super Speciality Hospitals. May I request representatives from Max Smart Super Speciality Hospital to kindly come on stage, please. The next category for the lightning talks in the diagnostics category. The first prize goes to Nanavati Max Super Speciality Hospitals. May I request the representatives to kindly come on stage, please? The second prize in the diagnostics category goes to Desun Hospital. May I request representatives from Desun Hospital to kindly come on stage, please? Which one? Students. Third prize in the diagnostics category, Daya General Hospital. Diagnostic categories winner, second prize, Desun Hospital. Third prize, Daya General Hospital. The next category we move on is the general and support services. The first prize goes to CMC Vellore. Christian Medical College and Hospital, Vellore. The second prize in the general and support services goes to Ganga Medical Center, Coimbatore. Second prize, general and support services, goes to Ganga Medical Center, Coimbatore. The third prize in the general and support services, BM Birla Heart Institute. May I request the representatives to kindly come forward? The next category in the lightning talks is the student category. The first prize goes to University Malaya Medical Center, Kuala Lumpur. May we have the delegates on the stage, please? First prize, student category, University Malaya Medical Center, Kuala Lumpur. The second prize in the student category goes to Indian Institute of Technology, Madras. Ladies and gentlemen, may we have a huge round of applause, please? First prize in the student category, University Malay Medical Center, Kuala Lumpur. The second prize, Indian Institute of Technology, Madras. Do we have the representatives? The third prize goes to MS Ramaya, Bengaluru. Third prize in the student category, Lightning Talks, MS Ramaya, University, Bangalore. IIT Madras, nobody came. That's it? Lighting is over. Lighting over. Lighting is over. Lighting is over. Oh. Lighting.
Moving on to the next set of awards. So it's a video competition award. The first prize goes to Dr. Geeta Fulari, Shankara Eye Foundation, India. The second prize is shared between two people. One is Ms. Girija Sharma from Fortis Hospital, New Delhi, the Shalimar Bagh campus. The second prize, which is again shared with the Fortis, is Mehta Multispeciality Hospital, and we request Ms. Tilagavati to come and receive the award. The second prize for the video competition so your name, sir? So Parthiban would receive the award because Tilagavati is not here from Mehta's Multispeciality Hospital, Chennai. The third prize goes to Jasmine Sayan from Apollo Multispeciality Hospital, Kolkata. Third prize under the video competition category, Ms. Jasmine Sayan, Apollo Multispeciality Hospital, Kolkata. This is shared along with Kriti Thambi from Rukmini Birla Hospital, Jaipur. Third prize is shared between two hospitals, and the presenters are Ms. Jasmine Sayan, Apollo Multispeciality Hospital, Kolkata, and Kriti Thambi, Rukmini Birla Hospital, Jaipur. Clinical, we move on to the next set of awards. This is clinical audit winners. The first prize goes to Dr. Saril or Dr. Komal Agarwal from Sakra Hospital, Bengaluru. The first prize for clinical audit goes to Dr. Saril or Dr. Komal Agarwal, Sakra World Hospital, Bengaluru. The second prize is shared between two people. One is Devjani Mukherjee from Tata Medical Center and Ms. Danya Michael from Lourdes Hospital, Kochi. Devjani Mukherjee from Tata Medical Center and Ms. Danya Michael, Lourdes Hospital, Kochi. The third prize is backed by, again, two people, Ms. Stella Mary Townsend, Kaveri Hospital, Chennai, and Ms. Munira Hanifa, Pantai Medical Center, Malaysia. Third prize, one from Chennai, the other from Malaysia, Ms. Stella Mary Townsend from Kaveri Hospital, Chennai, and Ms. Munira Hanifa from Pantai Medical Center, Kuala Lumpur, Malaysia. Yet another third prize with Kriti Thambi from Rukmini Birla Hospital, Jaipur. Clinical audit, the third prize we have Kriti Thambi
Rukmini Burla Hospital, Jaipur. But congratulations to you. Surprises are sweet. Research publication winners. Research publication winners. The first prize goes to Miss Ravi, University Malaya Medical Center, Malaysia. Again, a surprise. Again, sweeter. First prize to Miss Ravi Chandriga, University Malaya Medical Center, Malaysia. The second prize is shared between two. One, Dr. Saswati Das, Ram Manohar Lohi.
Her name. First
Yeah.
prize, who are the two people?
One person only, Ravi.
Second.
Saswati Das. The second prize is shared between two people, Saswati Das, Ram Manohar Lohia Hospital, and Brian D'Souza, Manipal Academy of Higher Education. Saswati Das and Brian D'Souza. The third prize. So is it Brito, Ganga Medical Center and Hospital Private Limited. The third prize is shared between two people, Brito Durai Singh, Ganga Medical Center and Hospitals Private Limited, and Karishma Kaun, Apollo Hospital, Guwahati. Do we have Karishma in the audience here? Yes, ma'am. So that's Karishma Kaun from Apollo Hospitals, Guwahati. Congratulations, please. Moving on to a next category of awards. This is a poster presentation for the clinical services. The first prize goes to Sheikh Manzoor Ilahi from Meta Hospital, Chennai. Dr. Sheikh Manzoor Ilahi from Dr. Mehta Hospital, Chennai. Yes. The second prize is shared between Dr. Deepthi Krishna from Rela's Institute of Medical Center and Dr. Payal Bose of Medica Super Speciality Hospital. The second prize for poster presentation in the clinical category is shared between two people, Dr. Deepthi Krishna from Dr. Rela Institute of Medical Center and Dr. Payal Bose of Medica Super Speciality Hospital. The third prize goes to Rajalakshmi Venkateshan, Aster Medicity, Kochi. The third prize for poster presentation clinical services goes to Dr. Rajalakshmi Venkateshan, Aster Medicity, Kochi. So in the absence of Dr. Rajalakshmi, Dr. Anna would collect. Dr. Anna would collect Dr. Rajalakshmi's award and certificate, Aster Medicity, Kochi. Moving on to poster presentation nursing services, the first prize goes to Miss K.S. Neetu of Rajagiri Hospital, Kochi. Neetu, Rajagiri Hospital, Kochi. The second prize The second prize is shared between two people, Miss Arya Kulkarni of Sahyadri Super Speciality Hospital and Mr. Hariharan, Regency Hospital Limited. The second prize for poster presentation nursing services is shared between Mrs. Arya Kulkarni from Sahyadri Super Speciality Hospital Private Limited and Mr. Hariharan Shankar Raj from Regency Hospital Limited. The third prize goes to Mr. Kanchan Devi, Fortis Hospital and Kidney Institute. Just check with Anita what she needs. The third prize, Kanchan Devi, Fortis Hospital and Kidney Institute. Poster presentation, diagnostic services. First prize goes to Lipsa of Medica Synergy Private Limited. Lipsa of Medica Synergy Private Limited. The second prize goes to Mrs. Rosie Naik from Meenakshi Hospital, Tanjavur. The second prize. The first prize goes to Lipsa from Medica Synergies Private Limited. The second prize. So you will do. Yes. So Mrs. Rosie Naik's prize would be collected by Balamurugan from Meenakshi Hospital, Tanjavur. The third prize goes to Suhasini Susai of Mahamana Pandit Madan Mohan Malviya Cancer Center and Homi Baba Cancer Center, Varanasi. Mahamana Pandit Madan Mohan Malviya Cancer Center and Homi Baba Cancer Center, Varanasi. So, Ms. Suhasini Susai, are you there? Is there anybody who can collect on her behalf? Fine. We move on to the next category, and that would be poster presentation and general and support services. The first prize goes to Mrs. Jeba Shakila, Meenakshi Hospitals. Suhasini Susai is bringing her little one to collect the award. Right, you can tell. So that is Suhasini Susai with her baby from Varanasi to collect. So say hello. Okay. So the poster presentation in general support services, Mrs. Jeba Shakila, Meenakshi Hospital, Balamurugan would receive on behalf of Jeba. The second prize goes to Satish Babu, Indraprastha Apollo Hospital. So second prize goes to Satish Babu, Indraprastha Apollo Hospital. Please, you can take it. So she's taking on behalf of Mr. Satish Babu and she will hand over in person to him. The third prize goes to Mrs. Ilaveni Selvaraj, Medibuddy Digital Healthcare Services. Medibuddy Digital Healthcare Services, that is Ilaveni Selvaraj. So we move to the last set of awards. And I think you should give a big round of applause because these are students who come and present amongst stalwarts. So you need to encourage them. So the last set of awards is poster presentation for students. And the first prize goes to Ms. Priyadarshini of MS Ramaya University of Applied Sciences, Bengaluru. Ms. Priyadarshini of MS Ramaya University of Applied Sciences, Bengaluru. Is there anybody from Ramaya to collect? Yes. You're Priyadarshini? Yes, please. Okay. The second prize goes to Suhail Sanullah. I'm sorry, Suhail Sansullah, KIMS Healthcare Management Limited. Second prize goes to Ms. Suhail. Are you there? Suhail? Right. So the third prize goes to Nikita David from CMC Vellore. CMC Vellore? Is there anybody from CMC Vellore? Dr. Lallu will take in behalf of them. Careful, 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 careful. Yeah, Miss Nikita David from Christian Medical College, Vellore. Please. One last bit of awards on the lightning category for students. Then over to Geeta.
The last set of awards in the Lightning Talks clinical category. The first prize goes to Rukmini Birla Hospital, Jaipur. First prize in the clinical category Lightning Talks, Rukmini Birla Hospital, Jaipur. May I request the delegates to kindly come on stage, please. The second prize goes to ICRA Hospital. Second prize in the clinical category of Lightning Talks goes to ICRA Hospital. Do we have representatives from ICRA Hospital? The third prize in the clinical category Lightning Talks goes to Fortis Hospital, Shalimar Bagh. Third prize in the clinical category Lightning Talks goes to Fortis Hospital, Shalimar Bagh. The third prize is also shared by CMC Vellore, Christian Medical College, Vellore. Third prize in the clinical category of Lightning Talks. Christian Medical College and Hospital, Vellore. We also have had the CEO boot camp, and we would like to give away the certificates. The first one, may I like to call Mr. Ranjit Krishnan, Group Chief Executive Officer of Kinder Hospitals. The CEO boot camp certificates. Second, may I call upon Dr. A.D. Edukondalu, Dean, Bharat Medical College, Chennai, Tamil Nadu. And lastly, may I call upon Dr. S. Ramesh Babu, Chief Executive Officer, Shri Kamachi Hospital, Tanjavur. Dr. S. Ramesh Babu, Chief Executive Officer, Shri Kamachi Hospital, Tanjavur. We now have some special announcements of our next conferences that we will be having.
We request the dignitaries, please take your seats. Yeah, go ahead. The announcements for the forthcoming events of CAHO. Some of the conferences.
We'll put up the video. Thank you so much.
Pleasure.
Thank you.
Thank you, Niram. Will be. Pleasure meeting you. What are dots for connecting?
Nobody is here. All these announcements. Like, we put the video by them. You put up the video.
ये तो सेकॉन और वो तो पहले करी दोनों announcements.
Done. These announcements. Vote of thanks.
हाँ हो गया वो. Take it as done kind of thing.
We have to thank God. I've done very well. I am doing happy at clockwork.
This one to you, a second and after that. किसमें किसके पास है इट इज है So ladies and gentlemen, now the next big event of CAHO is going to be August 30th and 31st at Mumbai. This is the Students' Annual Knowledge Conference. And this is targeted at the hospital administration students. And every year, this is again tractions, creating more traction. And almost 500 students we are looking at, and we are looking at more than 30, 40 institutions coming together to be a part of this major conference. Then, of course, please block your dates for CAHO Tech, which is at Indian Institute of Science, Bangalore. This is on 25th and 26th of October, 2024. And once again, now this is the 9th edition of this very major conference, which is bringing technology and healthcare together. It is focused on that, has become extremely important. So please block your dates. We hope to see you in Bangalore.
Ladies and gentlemen, prepare for our descent into Kolkata. The current temperature is a pleasant 33 degrees Celsius. We hope you have a great journey ahead at CAHOCON.
So this was definitely a thank you video. And so I think everybody from Delhi and around, please come up on the stage, including people from Rajasthan, Punjab, UP. You all have to be contributing to the success in Delhi. Dr. Gyani, you have to head the contingent. I don't know whether Sanjeev Singh has left.
Dr. Upasana Arora also.
Upasana Arora. What kind of?
Where is Rupak sir and all that? You formally handshake and hand over to them. Yeah. Do the formal handover.
Here. Come here.
You can formally take over.
Come. Colonel Binu, where are you? From? इंद्रप्रस्थ तो दिल्ली में है पूरा भाई आपको आगे आना है हो गया सब So I think the challenge for Delhi team is they have to do better than Calcutta. That is a challenge.
Thanks. Thank you.
You accept?
Yes, sir.
Okay, they accept the challenge. I have given them the challenge to do better than Calcutta. Let them try.
That's the capital city.
They devote
more resources.
Ladies and gentlemen, we hope you all have had a wonderful experience in the two-day CAHOCON 2024 event. And with this, we formally come to an end of the two-day conference. May I now request Dr. Lallu Joseph ma'am to kindly give a vote of thanks, please.
Good evening. And I think we have to thank a lot of people here. I think we have to give them a standing ovation for the kind of work put together by Kolkata, the city of joy. It's indeed being wonderful. Thank you for hosting us and thank you for all the support extended. Let's give the organizing committee of CAHOCON Kolkata a big round of applause and a standing ovation. Ladies and gentlemen here, please give them a big round of applause. Mr. Rupak Barua, Dr. Falin, Mr. Prashant Sharma, Dr. Shankar Sen Gupta. Let's give them a big round of applause. I think there are several people to thank. Shupratik, are you around? Please request the entire team to come on board. Come to the stage, please. Somrata, please come. and all the 15 hospitals that hosted the pre-conference workshops. If you are here, please come on board. We want to thank you profusely. Calcutta has treated us very well. Dr. Shushruth, the laboratory committee, please come on board. Dr. Ashwini, Dr. Shushruth, anybody around? Let's take 2 minutes. Long round of applause to all of them. Sudeep, please come. Here comes Madam Madhukari Ray. Please come. Let's have everybody here. Please come. Saurav. Thank you, delegates. It's not easy traveling from all over the country and globe to be part of this wonderful event. This time, we had more than 20 international delegates who joined us. Lot of participants from across the country. Let's give them a big round of applause. Not easy for them to travel from all over the country and being here. Our own chief guest, Honorable Governor of West Bengal, Dr. C.V. Ananda Bose, for his time, for the inaugural address and the very vibrant talk that he delivered. Our chief guest for this evening, Mr. N.S. Nigam, IAS, for Richard for traveling all the way from Tanzania and for being here with us. Thank you, dear speakers. 90 plus speakers from all over the globe. Let's give them a big round of applause, please. Long list of speakers, our own moderators, our patrons, senior faculty from the healthcare fraternity. Thank you all for being here with us the last 3 days. Pre-conference faculty, let me tell you, we had 105 pre-conference faculty who traveled and came for the 15 pre-conference workshops of CAHOCON and 13 pre-conference workshops of the Laboratory Con. Let's give them a big round of applause, dear friends. It was not an easy job evaluating the submissions. We had more than 700 plus submissions for all the competitions that we announced. We had good number of pre-evaluation jury who went through it very meticulously and made sure we did not miss out any submission. Thank you, pre-evaluation jury, and all the jury who have worked so hard yesterday and today for reviewing all the presentations. Without our knowledge partners, our academic content would not have been perfect. We thank all our knowledge partners for the support extended. Thank you, Centers for Quality Promotion of CAHO. With the 2 latest edition, we are 38 plus strong army of Centers of Quality Promotion. Thank you, dear title sponsors, Basin Hospitals, Biomerio, Apollo, Amneal, Platinum sponsors, Dosi, Charnock Hospitals, AACI, BD, Monel K, Roche, CK Birla, CMRI. Gold sponsors, the Joint Commission International, Walter Clovis, Shija Hospitals. Silver sponsors, Peerless Hospitals, Pfizer, Manipal, Linde, Inolid, Kaveri Hospitals, Bethany Hospitals, AMTZ. Several bond sponsors, the delegate kit sponsor, Narayana Health. Technical partners, our own assessment partner, Pearson View. Design partners, the Circus Solutions. Media partners, Social Sculpt, Executive Dialogue, Healthcare World, Double Helical. And app partner, Smart Consultant. Event partner, let's give them a big round of applause. The Times of India for the support extended for organizing this event so well. All the pre-conference workshop partners, the CAHO Secretariat. Again, they deserve a big round of applause. Dr. Sakshi, Bobisha, Prakash, we have Anita, Meenakshi, and all the young girls here who worked tirelessly for the past 3 months. I don't think they slept. Let's really give them a big round of applause. Thank you, one and all. Big thanks to our own organizing committee. Once again, dear friends, we are going to miss Calcutta. Last 1 year, we have worked very hard and the team was always smiling. Thanks to our organizing chairperson, sir, it was your temperament that kept it going. Thank you so much. And I hand over to Dr. Agarwal for the last word.
Hello. The last word is only thank you and see you at Mumbai, Bangalore, and again in Delhi 2025. We need your continued patronage. We continued your love and affection. We also need your feedback. We need your guidance. How can we improve? We have a long way to go, but together we will travel this journey and make an impact on patient safety and quality in this country. And that's what this organization will be known for. Thank you very much, ladies and gentlemen. Thank you.
Thank you. Let's rise for the national anthem.
तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जन गण मन जय हे भारत भाग्य विधाता जय हे जय हे जय हे Jai 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 Jai
Good. Thank you.
It was very well done.
Thank you. Chalo, goodbye.
Good. Sitting now.
Goodbye, Abhi.
Come. Sir, they want a picture.
Where you go? You're here? Right. Okay.
Where is mine?
Congratulations.